Hi everyone. In this week's video we're going to be talking about tongue tie. Now tongue tie is a condition that affects around about 10% of babies, and what happens is the frenulum, which is a really thin membrane, and it anchors the tongue, so it's found underneath the tongue and it attaches the tongue to the bottom of their bottom jaw. It's supposed to be long enough that allows the tongue to hit the roof of their mouth and enable their tongue to stick out, but sometimes it's very short, or sometimes it's actually right at the front of their mouth, so at the tip of their tongue, and it actually prevents the tongue from moving very much at all. Now, sometimes we'll have babies diagnosed with something called a posterior tongue tie, where it's that bit further back, and they're a lot harder to diagnose, and those are the ones that may or may not need anything done to them. The ones at the front, the anterior tongue ties, are the ones that are really, really obvious, and these are the ones that tend to cause problems with breastfeeding, with speech later on in life. So it's important that if you've got any problems with breastfeeding and you think it may involve a tongue tie, that you look at all those options, and when you're discussing whether or not you want something done about that tongue tie, that you look at later in life as well and how it may actually affect speech and language.
So you might be wondering, how will I know if my baby's got a tongue tie? Because that's often, what people say, isn't it? So you may actually notice it yourself, and you may look in your baby's mouth and think, oh yes, that looks like a tongue tie.
Because it can be obvious, can't it?
Yeah, it can be really obvious when baby opens its mouth, or your baby might not be able to stick its tongue out as far as what you might imagine it would be able to. Or you may have, your midwife might recognise it, when she's doing the initial checks of your baby, or when you have your baby's newborn check to start with, the midwife or the paediatrician might notice that there's a tongue tie there. Or you might be looking out for it in the first place, because they often do run in families, don't they, Lesley?
Oh, definitely. I mean, my mum was a tongue-tied baby. I was, and my daughter was. So yeah, certainly it was something that I knew to look out for, but whether or not that was because I was a midwife or I don't know.
So like you said before, some of them can be really obvious, can't they? Like this picture here.
Yes.
Where you can clearly see that the tongue is tied right to the end of baby's tongue, and it almost makes a little heart shape, doesn't it? Or it can be really less obvious than that.
And I think these are the harder ones, aren't they? Where there's that, is there a problem, are we going to cause more problems by trying to resolve this by having the tongue tie snipped? Or actually, if we ignore it, are we storing up problems for later in life? And really the only person that can really make that decision with all the information is the mother themselves, really. Yeah. But it's important that they get that information from paediatricians, midwife, lactation consultants, to get as much information as possible.
So I think what women do ask is, when would I know that this was actually becoming a problem, for me and my baby? And I would say that it's often spotted during breastfeeding.
Definitely.
That's definitely in the early days, isn't it? The early days of breastfeeding. And I think that it's often a noise. So it's like a
clicking,
sort of clicking noise that you hear your baby do, because breastfeeding should be pretty quiet, and you shouldn't be hearing those clicking noises. It'll then start to develop in a way where you'll realise that maybe your baby isn't weeing or pooing enough, and then probably not gaining enough weight.
Because again, it's that problem with the attachment. The baby's not able to open their mouth wide enough, stick their tongue out to be able to get enough of the breast tissue in their mouth, so they end up having to suck the milk out rather than squeeze the milk out, and that uses a lot of energy. And also, it's not allowing that really fat, rich milk at the end of the feed that's sort of stuck around the side of the milk ducts to become part of that milk. So they end up with a sort of the more watery less fat-rich
Yeah.
milk. So understandably, very windy poos as well. I can always remember.
Yeah, because they're taking in quite a bit of air as well,
Yeah.
aren't they? With the when they're feeding.
And then women usually always report quite painful nipples at that point.
Yeah, because the nipple isn't in far enough, the nipple is actually being put against the jaw, the bony bit of baby's mouth, so it will become more sore. So, what can we do? What happens next? I think it's important to remember though first that even if you spot a tongue tie and it's quite obvious, it might not be a problem.
Absolutely, and I think that's why
it doesn't
it's so
need an
important.
answer.
Yeah.
It doesn't need fixing or anything. It just, needs to be left.
Yeah, and certainly that first sort of 2 or 3 days before the milk comes in, it's quite difficult to really make an assessment of milk transfer, milk production. It really needs to be sort of between day 3, day 5, when you've got a really good supply of milk that healthcare professional or the lactation consultant can really make that assessment. And there's lots of ways that you can actually modify the positioning and the attachment of baby as well. So even if you do have a baby that's tongue-tied, your sort of breastfeeding professional will be able to show you how you can actually help baby get more breast tissue in their mouth and hopefully enable you to be able to breastfeed without pain, and possibly, you won't need to actually have your baby's tongue tie snipped.
Yeah. So if there is a problem and it's been assessed and we're feeling like that tongue tie is being snipped is going to be, the answer to the problem, what would we do next?
So that's definitely your midwife or your health visitor or your GP will be able to arrange that referral to that, either the oral consultant. There's some midwives are tongue tie practitioners as well, but your GP or your midwife will know they'll be able to access those professionals. And it's those professionals that will make the assessment as well about whether or not it's necessary, rather than the mum themselves. I mean, the mum themselves will have that final decision about whether or not that's something that, she wants done. But it's always worth asking the person that's making that assessment, will this affect my baby's speech later in life? Because that's something that we do need to think about.
I think we should also mention the baby as well in all of this, because I think and the parents, because they think, my baby's having a procedure, an operation, but it can be really quite although it's going to be painful for the baby, it's very short-lived. It's seconds, isn't it?
Yeah,
and the baby can go straight onto the breast afterwards, and the difference is quite obvious, and the baby then becomes more settled, sort of really quite straight away. So, it's not something that, although it's difficult to make that decision to go through with it, it isn't something that's a long-lasting, painful procedure for baby.
Yeah. So that's all for this week. If you like the video, share, like. If you've got any comments, comment down below and click on subscribe. And we'll see you next week.